You know the best way to start your morning?
Relax. We brought you to the best place in town.
I'm getting too excited.
1480 WHBC and WHBC.com.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. Joining Brad and I this morning are our special guest, Kate Anderson, registered and licensed dietitian at Mercy Medical Center Outpatient Department. Good morning. Welcome to the show.
Good morning. Thanks for having me.
Diabetes is a challenging disease to manage successfully. From medication to monitoring and from exercise to diet, there's a lot to coordinate, understand, and manage. Although the care regimen is complex, patients with good diabetes self-care behaviors can attain excellent control. Patients do best when they understand what they need to do and when they feel empowered to effect a change in their life and when they believe the benefits exceed the costs. Today, Kate will share her knowledge and tips to help you or your loved ones understand how to manage diabetes. We'd like to remind our listeners that you can subscribe to our radio show on our podcast. You can open your favorite podcast app and look for Health Matters with the Medicine Center Pharmacy. And please subscribe and check out our programs anytime you like.
So, Kate, introduce yourself, please, and tell us what you do at Mercy Medical Center.
All right. Like I said, my name is Kate. I'm an outpatient dietitian at Mercy. I've been a registered dietitian for almost 16 years now, and about 5 of those have been spent with the Mercy family. And I get the opportunity and honestly the privilege to work with the community, and we focus on behavior change, lifestyle modification, on helping better manage all kinds of chronic conditions, from blood pressure, cholesterol, and especially today's topic, diabetes.
So for those people that are unfamiliar with diabetes, what is it? What's diabetes?
So diabetes, again, is a chronic condition. And it is when it's either your pancreas is not producing insulin, or your body is not producing enough insulin, or you are resistant to the insulin you're producing. And I think we'll get into that in a little bit with the different types. But if you think about insulin being that key that unlocks your cells, that allows you to use your energy from the food that you're eating, is why that hormone is so important.
Okay.
So let's look at some numbers. How prevalent is diabetes in the United States?
According to the CDC, the 2020 statistics they have out right now, it's about a little over 1 in 10 adults. And a bigger number is actually 1 in 3 are pre-diabetic.
Mm-hmm. So what's the difference between type 1 and type 2 diabetes?
Type 1 diabetes, this is an autoimmune disease. And so with this is when your pancreas is not producing any insulin. So it is very important, obviously, for you to use your energy to have that. And that's going to be a lot of management and teamwork between you and your doctor. Whereas type 2 diabetes is more of a metabolic disorder. And this is when you're still producing insulin, but it's either you're not producing enough, or the insulin that you are producing, you are resistant to. So again, it's something that's not allowing you to use your food and energy efficiently.
So what foods influence blood sugars the most?
Okay, so when you think about your food, 3 main places where we get our calories from. We get them from fat sources, protein sources, and carbohydrates. So when we think about diabetes and how it affects our blood sugar, we want to focus on the carbohydrates. So I usually, joke around with patients and say it's basically all the foods you like that you have to be careful with. And those are going to be things from your breads, crackers, and cereals, your pasta, rice, and grains, starchy vegetables, and those are going to be things like peas, corn, and potatoes. Also this time of year, pumpkin and acorn squash and butternut squash. Then you have all your fruit and fruit juices, beans and lentils, milk, soy, and yogurt. And, of course, all the desserts. So cakes, candies, cookies, jellies, jams, syrups, etc.
Okay, so you listed about every food that was possible to consume in the world. So, all right. True or false? Diabetics cannot have any sugar.
That is false. So what we have to remember is sugar is the most simple type of carbohydrate. So when you think about how to incorporate sugar into a diet, you want to make sure that it's balanced with everything from fat and protein, along with regular physical activity, because sugar is the type of carbohydrate that's going to be an instant hit right away to your blood sugar. So just having it in moderate amounts is going to be the key to fitting that in.
Okay. I like peaches a lot. Okay.
Mm-hmm.
And I happen to be a type 2 diabetic. Okay.
Okay.
You're supposed to eat fresh fruits, but the fresh fruits pretty much zap my glucose up. So what do? I want to eat the fruits. Okay.
Sure.
I like the peaches, the cherries, the grapes, all that kind of stuff. Okay.
Mm-hmm.
What do we do here?
Okay, so first thing to remember, and I remind people, when they come in for an education, is you're an individual. So there's a big learning curve that starts with understanding how foods are going to affect you. And that just means that when you eat a peach and maybe someone else with type 2 diabetes eats a peach, you could have a very different response in the body. When you think about a carbohydrate, it's going to send your blood sugar up pretty quickly. And what you do to flatten that curve or, slow that down is to make sure you're not just eating the peach at one time, but you're combining it with a little bit of the other energy sources, such as from a protein or a fat. So if you have that peach, then you also, in addition to that, maybe have a serving of almonds or maybe a side, like a low-fat strained cheese, or something that you're putting in there, again, that's offering those other nutrients. So it's not just the sugar from the peach, but remember the peach also has the beneficial type of carbohydrate, which is the fiber. So that's also working in your favor.
Okay, I got off schedule here. I noticed that there's been a lot of changes in how foods are labeled. Mm-hmm. Can you explain these changes?
All right, so on the food label, one of the first changes you'll notice is that the calories are nice, big, and bold. And they also have increased the serving sizes to reflect maybe what someone's going to eat at one sitting. So a good example of that, the 20-ounce bottles of soda. They used to, on the food label, reflect they would have 2.5 servings in that bottle. Whereas now they're going to say, we're going to reflect all the energy in this item to show what you would have at one time. So it would be, for the whole bottle. So serving sizes were increased to reflect what someone might consume at one sitting. Another change that was made when you look, and this is my favorite change because it deals with the carbohydrates. If you look on a food label, if you have one near you, you can see that there's a line that says total carbohydrate. And then right underneath that, they break it down into, of that total carbohydrate, what's coming from fiber and what's coming from sugar. Under the sugar, they're now breaking that down into what was added. And the added sugars is one line that a diabetic should really be paying attention to, because you don't want more than about 5 to no more than 10% of your total calorie intake coming from added sugars daily. And then at the bottom, they got rid of vitamin A and C because we tend to have plenty of that in our diet, and they added vitamin D, which if you don't know where your level's at, and now that it's getting dark at like 3:30, it is important that we get either are on a supplement or we're paying attention to how much of that is in our diet, as well as potassium.
Interesting. I was looking at a bottle this morning, and it had big 0 on there, and I thought, gee whiz, where'd this come from? I just, maybe I hadn't noticed by that. How long have these new regulations been in play?
They've been slowly rolling out. There was kind of a hard set line that it was supposed to be last year, and then like with anything, they kind of keep pushing things back. Now you will notice on the majority of food products that the new format has been in there. And it's probably been in there for, I would say at least going on a year now, but you've probably seen the updates for at least the past couple slowly rolling out.
Okay. So what are the three types of carbs? You just said this, I think, but if you would repeat again, and how do they factor into the diabetic's diet? I mean, I realize that in moderation, okay? I've always been told, but, you know, this is kind of a science to put this thing all together on what to eat, how much not, and all that sort of thing, you know? What do we do with this?
Sure. So the total carbohydrate, again, that line on the food label, that's going to reflect the three types of carbohydrate that's found in that food product, and that's going to be all of the starch, all of the fiber, and all of the sugar. So when you break that down, the two most important ones for a diabetic to be paying attention to, they're going to be listed right underneath that total line. So if on that line, let's just say that the total carbohydrate was 30, they're then going to break that down into the fibers. Of that 30 grams of carbohydrate, what of that is fiber? The reason fiber is so important is because it's the type of carbohydrate that our bodies can't completely digest. So everything about it is great. It helps keep us full. It helps with good blood sugar control. It feeds the good bacteria in your gut. It keeps you regular. So again, everything about fiber is good, except in the Western diet, we have a very processed diet where in the processing, the first thing that we lose is the fiber. And so for a diabetic, when they're looking at things like cracker and cereal and breads, they want to make sure that their fiber, the ratio is at least 1 gram of fiber to every 10 grams of total carbohydrate. So I don't know if this will help at all, but I have a little sample here of Fun Chips. And just kind of showing this has in a serving, there's 19 grams of total carbohydrate, and there are 2 grams of fiber. So that fits that ratio of there's at least 1 gram of fiber to each 10, total grams of the carbohydrate. Does that make sense?
Yeah, it makes sense. Yeah. Okay.
Oh, okay. And then the total sugars, like I said, they're going to break that down further into what was added. And so remember, all of those are still in that total number, but you really want to control that added sugar. And what that looks like for the average person is about 36 grams of added sugar for an adult male and about 24 for women.
I don't know if we have
and that 36 grams isn't considered excessive per day on average. Is that what you're saying?
It is not. So to put that in a little more perspective, if you take out a teaspoon at home and you put that in your sugar bowl, and you have a level teaspoon and then dump it into another bowl, you can see that's what about 4 grams of sugar looks like.
Okay.
So if you do that 9 times, about 9 teaspoons, for a man and about 6 teaspoons for a woman to be added sugars a day. And to put that in a little bit more perspective, in 1 can of Pepsi, just a 12 ounce, there's a little over 40 grams of sugar. So that's a little over 10 grams of sugar. So you can see how quickly your added sugars come into your day. And that's not counting added sugar in a cereal or a breakfast bar or a salad dressing or bread or a granola bar or anything like that.
Okay, Kate, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing healthy eating for individuals with diabetes with Kate Anderson from Mercy Medical Center's outpatient department.
All right. Before the break, we were getting a nice primer on fiber ratios to carbs, which I guess I never knew, embarrassingly, so that was really neat. So let's talk a little about protein and fat. How should they be incorporated into a balanced eating plan?
Okay, so a good analogy to think of it are Cedar Point roller coasters. So when we think about carbohydrates, we don't want those massive big hills and then the quick drops. And with carbohydrates, if that's all you're eating, especially simple carbohydrates, it's going to cause your blood sugar to go up very quickly, and then there's nothing to really sustain that. So again, you're going to come back down pretty quickly. What you want to see is more of that gradual rise and gradual fall in your blood sugar. And what helps slow that down, the way that you digest and the way that you absorb and the way that your blood sugar goes up, is to include some fat and protein with that. So protein has a minimal effect on your blood sugar. So it's going to slow everything down and it's going to sustain you because you want that 4 to 5 maybe hour window in between your main meals. That typically works well. And then the fat really has no impact on your blood sugar, which means, again, that's kind of in the background, keeping everything, that slow rise, slow fall, helping to put everything together.
All right. So I've been trying to be more mindful of what I eat lately, too. And, it's been a lot of stress during the pandemic, and I'm sure people have felt that. And while there's people trying to be good in the kitchen, when you need that break and you want to get carry out or eat out somewhere, what can you do to improve your eating habits when you're not in your own kitchen, controlling the whole environment?
I think if I had the answer to that.
Yeah, that's a problem. You're in your kitchen.
I am. Well, with eating out, it puts a responsibility on you. And think of it this way. The 3 things that flavor your food are fat, salt, and sugar. So any of those in excess have the potential to have a negative impact on your health. So when you're eating out, we are not going out to count carbs. We're going out to socialize, and we're going out to relax, and we're going out to enjoy our time. So looking at things ahead of time is going to be the key to trying to help better control this, because ignorance is bliss when it comes to eating out. And I thought it would be kind of fun for you guys. I want to play an over-under game. So for a Wendy's apple pecan chicken, a full-size salad with dressing, do you guys think there is more or less than 900 milligrams of sodium in it?
With dressing, I'm gonna guess more.
Yeah, me too.
Okay, you're absolutely right. A lot of times when we think about salad, we think, okay, we're being healthy, but there's actually over 1,000 milligrams of sodium in that full-size salad. And when the daily recommendation for someone is going to be less than 2,400 milligrams of sodium, so you can see that takes up about half of your sodium in that one meal item.
And is that dressing related primarily in that case or not?
Some of it, but then you also have the meat that's put on there. Again, there's so many competing restaurants out there. They want you to come and have their food, and it tastes the best. So we've got, again, in excess of that, one or more of those three ingredients. The other thing, a small pumpkin spice latte, how many grams of sugar do you think you're going to find in that? And this is no whipped cream.
Yeah.
I'm going to guess at least 20.
20, okay.
Yeah, that number's off the wall, I'd be sure, but it's got to be more than that.
Okay, we're looking at about 40 grams of sugar.
Yeah.
And that's in a small, and that's without your whipped cream. And so, again, you can kind of see how this puts that responsibility on before you go out to eat. Look the food up ahead of time. That information is available. There's a website that I use a lot. It's called CalorieKing.com, and it has a lot of the chain restaurants where you can go and look up the nutrition information. Again, to know what's in your food. One more I thought was good was the Olive Garden chicken Alfredo. So at a mealtime, just to give you a reference, women should have 30 to 45 grams of carb at a meal, and men about 45 to 60. Of course,
that's really good, though. That's really good.
You're not helping, Paul.
I know, but that's really good.
All right. But take a guess. How many grams of carbohydrate do you think are just in that one meal?
Geez. It's over the hill. I know that. It's good. It's really good.
It is so good. It's over 100 grams of carbohydrate.
Yikes.
And that's not counting, a 25-gram carbohydrate, one breadstick, that you had maybe.
Yeah, you throw in a breadstick. Yeah.
Because you only had one.
Yeah.
I mean, if you're a woman, you've almost had your total carb, but you can see how quickly things add up if you aren't aware of, where your food sources are coming from, and again, what's in your food.
Guess what? It's time for the news.
Oh.
Thanks for listening. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
It's a winter wonderland at Studio Arts and Glass. Our annual holiday open house now through Thanksgiving. Take 20% off your entire order. Hand-blown glass ornaments, your Santas, jewelry, come make a wreath or a glass snowflake. 20% off your entire order. See our extended holiday hours at studioartsandglass.com. Shop local this holiday season.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station, News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing diabetes with Kate Anderson from Mercy Medical Center. We've got a lot more to cover this morning, so let's get back to the show. My favorite subject is sweeteners, Kate. Let's talk about artificial sweeteners and how they affect your blood sugar.
Okay, so artificial sweeteners, first of all, they are approved, by the U.S. Food and Drug Administration for safe for us to consume. They're the most common ones that are out there are saccharin, aspartame, stevia, and sucralose, and those are going to be more commonly known as Equal, Sweet and Low, and Splenda. With those, we do not digest them, so it doesn't cause an insulin response in your body. So you're going to get that sweet flavor without affecting your blood sugar is what that's referring to. The thing with artificial sweeteners, though, they are hundreds of times sweeter than regular sugar. So I always, there's with everything, how you said moderation and balance is truly the key to everything. When you're using your artificial sweeteners, you do not have to use as much as you normally would with the sugar because of that intensity. And if you're always looking for that high intensity of sweetness, and then we have, just the regular naturally occurring sugars from a peach, you don't appreciate it as much if, your intensity level is always way up at 100 and, we're way down here with just, again, the naturally occurring sugars. So just be careful how much you're using at one time.
Do you think the consumer is conditioned to like super sweet products because of the beverages, the diet colas and stuff like that are out there? I sort of think that, and I don't drink a lot of it, but once in a while, and I think some of them are just almost disgustingly sweet, whereas there's some out there that are okay. Right? So what do you think?
Well, with something like that, again, if you're used to having something very sweet, and then you see some of these drinks that say just naturally sweetened with, blackberry or raspberry or something like that, you're not going to be able to transition well, jumping from one to the other. So I always recommend people to kind of do a step-down process so that you're kind of doing maybe a half and half. Going towards, again, the drinks that are naturally flavored and don't have any artificial sweeteners in them. I do believe, obviously, water, we're made up of primarily water. So water is going to be that number one beverage that we want to make sure we're drinking and we're getting in our day. But if you are used to having those artificial sweeteners and then you try one of these drinks out there that, again, just have naturally occurring sweetness, I'm just warning you, there's going to be a big difference between that. So kind of gradually work your way into that.
So what about sugar alcohols? What are they?
Well, chemistry wasn't my best in college. So we're not going to go too much into it. No, but sugar alcohols, the difference with artificial sweeteners, sugar alcohols we actually do digest. So they have a minimal impact on your blood sugar, and they are not as sweet as artificial sweeteners. So with the sugar alcohol, they are required to be listed on the food label, and you can identify them most in the ingredients by things that end in OL, typically. So that's going to be things like erythritol, mannitol, sorbitol. Erythritol is very common. This is used in a lot of maybe like ice creams and candies and chewing gums.
Okay.
So being an individual, Paul, you know, if you started to add sugar alcohols into your diet, you would want to test your blood sugar just to see how your body responded to that. And one important thing, because a sugar alcohol is technically, it's not a sugar and it's not an alcohol. It's, again, it's the chemical makeup of it. You just want to make sure that you know how your body responds to that, but also it doesn't mean carb-free. So it can be very misleading. Like, let's say on a candy or something, it'll say sugar-free because, again, technically sugar alcohols are not sugar. So it'll say sugar-free. And just remember that doesn't equal carb-free.
Stevia is touted as a natural sugar sweetener. Okay. What's your story? I mean, do you have a favorite sugar substitute or one you mostly recommend?
I don't know if I have a favorite. I think that, again, this is going to be individual because I've heard plenty of people over the years, you know, sometimes people are sensitive to them, whether it's a headache or an aftertaste or just something that doesn't agree with them. Again, I think you just have to see what is going to work for you. I like stevia just because it's been around forever. It's plant-based. You can actually grow, you know, your own stevia and just use it that way. But they also have it in liquid drops in a powder form.
Powder, yeah. It's
all kinds of ways to use that.
I think the dropper and the shaker is a little bit difficult to use because you have a tendency to overuse it. I mean, the drop comes out as a big drop, not a small drop, and you know.
One more thing to mention on your sugar alcohols, I forgot. With digesting them, some people struggle with digesting them. So if you notice that you're starting to put a lot more of those into your diet and you're having gas, cramping, bloating more than usual, try taking those out of your diet and see if that improves.
Interesting. So what about inflammation in the body? You just mentioned sugar alcohols. Any other issues with the sugar sweeteners or as far as inflammation?
With sugar alcohols and with artificial sweeteners, we're not concerned with inflammation. But there was just a study, it was a recent study, and it was the Nurse Health Study and the Nurse Health Study 2 and the Health Professionals Follow-Up Study. And this was millions of people involved. And what they looked at was the diet and the inflammatory foods, and then they looked at insulin resistance. And what they found and concluded was that when you have a high amount of high inflammatory foods in your diet, that this absolutely is connected and related to developing insulin resistance, which then can lead to type 2 diabetes.
So certain foods that can help or hurt inflammation in the body?
Exactly. So foods with high inflammation in the body are going to be the processed foods or refined carbohydrates. Sugar is definitely one of them. Fried foods, red meat, margarine, shortening, lard, and alcohol. Those are a lot of the high inflammatory foods in the body.
No steaks, huh?
What's that?
No steaks? No steaks.
Palm of your hand, Paul.
No beef, that's no good.
once or twice a week, palm of your hand.
Ooh, once or twice a week, oh my gosh. Okay. All right.
So what about, you mentioned those food categories are inflammatory. If people have a food intolerance, like maybe a food allergy or a delayed food allergy, I'm assuming those would also fall in that category. Like maybe, you know, I've always heard that peanuts are somewhat inflammatory and things like that. Does that play into that too, or is that beyond our scope today?
I don't know if it's beyond our scope, but I think that's more of on an individual basis of someone understanding, again, in their particular, because we can talk about all these recommendations, and there are wonderful recommendations and dietary advice out there, but I think what it comes down to is becoming an expert on yourself and on your own health and knowing. And there could be foods that are, again, cause more inflammation. So again, that is going to be connected with the insulin resistance.
What about the hot peppers and people? It seems like the younger generation likes highly seasoned food, peppers, and all that sort of thing. What's the story with that?
Well, in any kind of, if you're having more produce, are you just talking about like any kind of peppers or? Well,
hot peppers and what do you call them? I can't remember.
He's not a Mexican food fan, so maybe you can categorize it that way.
I'm not. Yeah, I'm not. I eat a taco with nothing on it but meat,
Well, I don't necessarily know if spicy equals inflammation. I don't think that's connected. I think that's going to be more for possible reflux, conditions.
Yeah, sure, yeah. Okay. Sure. Just so you know, just for my information, what about the Mexican diet? People that are Mexicans, okay? Now, they eat a lot of these heavily seasoned foods. Mm-hmm. What's their picture on diabetes?
So when you maybe look at different cuisines, you can see in that we have, let's talk about carbohydrates. You have tortilla, you have beans, you have corn, you have rice. And when we think about portions and then the amount that you're having at one time, it's truly, it's the balance of that meal and it's how much you're having at one time. So I'm all about seasoning your food, but that's going to be with things like cilantro and garlic and things that are not going to add sodium to your diet. Mm-hmm. But it's going to come down to how much you're eating, what your portions are.
Okay.
Is there a dietary discipline? Like, I guess I've heard, Mediterranean diets are more heart-friendly. Are they diabetes-friendly too? Is there if you're listening to the program today and you've given all kinds of great knowledge about carbs and proteins and fats and salts and sugars, now you're thinking, okay, where do I begin? Because now I don't feel like I can eat anything. So what do you tell people who are trying to find balance and eat a nutritious diet, but not maybe try to have a little bit more control in what direction they go? Is there a simple approach?
Sure. Oh, I hope I didn't come across that way as people can't.
No, but
No, honestly, you touched on one of the most heart-friendly diets, and that is the Mediterranean diet.
Yeah.
And that's because a lot of the foods that are incorporated in that are all about low inflammation in the body to no inflammation. And those are going to be things like your olive oils and your dark green leafies, any kind of produce, nuts and seeds, low red meat, lean proteins, all of these wonderful things. I guess to put it easy, to quote Michael Pollan, he is the author of Food Rules, and he said, if it comes from a plant, eat it. If it's made in a plant, don't. And so that can be very difficult because, again, a lot of the quick grab and goes, we have very busy lifestyles, like how do we make this work? I just want to encourage you to really challenge yourself to eat food in its most natural form. So eating more whole foods, eating more produce, nuts and seeds. How you prepare your food matters, how much extra fat you might be using during the cooking process. All of these things, they might seem little when, let's say, like instead of just like chunking off a thing of butter and putting it in your pan, now you're measuring. Those are the kind of little changes we try to hone in on and how to improve that so that it's the daily decisions that are, again, giving you better health.
Okay, it's time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Yes, we are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play: our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters. We are talking this morning with Kate Anderson from Mercy Medical Center, and we're tearing up my diet, man, with all the stuff she says. Moderation, folks, moderation.
All right, let's see here, Kate. A couple things we didn't touch on yet. Let's say a family member or a loved one is diagnosed with diabetes, and does that automatically mean you have to start cooking 2 different meals for dinner for the family every night, or can you find a balance?
No, we absolutely do not encourage that. That is going to, it's not magic food that someone is eating when they're diagnosed. It's math. So what that means, again, it comes down to is the balance. And honestly, we should all be having that balance. We all require protein. We all require healthy fats. We all should control the amount of carbohydrate that, we're taking in at a mealtime. So I think that's probably one of the worst ways to approach it, is making someone feel isolated and that they're eating these magic foods that the other family members can't eat. We want to focus on having those non-starchy vegetables make up the majority of your plate, and maybe having multiple options at a mealtime. And then the healthy plate for diabetics, if you take a look at that, it's divided that way that half your plate is non-starchy vegetables, a quarter of your plate is where one of your grains can go, a quarter of your plate where your lean protein, and then you've got maybe a glass of milk and a side of fruit on the side. So as long as the options are all there, then everyone can decide how much of each item that they would want to have. So that balance, again, that math is going to look different, but the foods do not.
Anything else you want to add about good snacking? Is the theory with patient with diabetes, one of the things we hear when they come in the pharmacy is, well, I only had one meal yesterday, so my blood sugar should be really good. Can you touch on skipping meals and how to snack responsibly, and what a garden variety day would look like that's okay? Because just because you have diabetes doesn't mean you can't eat.
Oh, absolutely. And that's probably one of the worst things you can do. And everyone's blood sugar, whether you're diabetic or not, in order to feel good and have good energy all throughout the day, you want your blood sugar gradually rising and gradually falling, so that at each mealtime you're back at a fasting level. When it comes to snacking, this is going to be on an individual basis. I think that snacking is the perfect opportunity to get more whole foods in your diet. So challenge yourself and see if you can get, produce as, that snack. So you grab an apple instead of a glass of apple juice. Or you have, celery or carrots or peppers. There's so many different non-starchy vegetables, again, that are going to allow good nutrients. Because our problem with snacking, a lot of the things that are offered are just refined carbohydrates. They're quick grab and goes. So you can really throw your blood sugar off. The other thing to remember, your body only can use a certain amount of energy at one time. So the fact that you think, hey, if I don't eat or if I only eat one meal, all you're doing, you think of a fire example, think of a big fire. If you throw a little kindling on that fire, it's going to burn up pretty quickly. Whereas if you throw that Yule log on, it's going to sit there and just kind of burn and burn and burn. So we want that kind of quick burn. We want those regular meals, nicely spaced. And we know that life is not perfect. So it would be nice if we could always have that eating schedule, but that give yourself some grace when it comes to the perfect schedule and the perfect diet.
So you walk into a convenience food store and you're looking for a snack, okay? There's no celery on the counter and there's no carrots and, normally there's no fruit. So what do we buy? A bag
of, you're going to plan ahead.
A bag of chips,
You're going to plan ahead. You're going to have an apple in your pocket and you can walk into that.
How about a hot dog?
You're killing me.
I know, it really amazes me when you look at those counters about, okay, what do I buy here that it just gives me something but doesn't tear up my body,
Well, I've noticed there's a lot more prepackaged, like trail mix type things that include dried fruits and different nuts and seeds. So those can always be a good option.
But dried fruits have a lot of sugar in them.
Fruits do have a lot of sugar in them, but remember, they also have the fiber in them. And it comes down to, again, how much you're eating. So I can't stress that enough. I never want someone to feel like there is a food that's off limits completely to them. I think it's a matter of understanding how your body responds to that food and understanding then how you can either have less of that or be pairing it different with other foods to see how your blood sugar responds.
Okay. So the American Diabetes Association used to have a plate. Okay, with certain, sizes of openings in the plate, and protein and fat and sugars and carbs and whatever. I haven't seen that around lately. That seems like that's kind of gone away. But what's better than sitting down for a Thanksgiving meal than a pile of turkey and mashed potatoes and dressing? Okay, how many fat calories? It's just and cranberries. Okay, which are loaded with sugar. Okay. What's our advice for Thanksgiving people here?
Do we really want to go there right now? I mean, we're a couple weeks away.
I know. You want to be on next week? Oh, we can talk about Thanksgiving.
No. So I think what I would challenge you to do this Thanksgiving is remember that well, first of all, it's a different looking Thanksgiving anyway because of the virus going on. So let's make food look different too, and with that, instead of thinking that you have to have a large serving or portion of everything, challenge yourself to the 2 tablespoon rule. So you're not putting any foods off limit, but you're trying everything, and it's more of sampling rather than servings. And then this can sometimes slow down, again, how much you're eating, the variety and the balance of what you have. And the other thing, when you think about Thanksgiving meal, I mean, you have corn, you have potato, you have rolls, you have stuffing, you have all those wonderful desserts and all these things, but they're all carbs, except for that turkey. So it's going to come down to, again, balance of maybe what's one new side dish you could add this year that adds a little more, whether it's healthy fat, protein, or a more complex carbohydrate with that fiber in it.
Okay,
hey, Kate, can you give our listeners your contact info so they can get in touch with you at Mercy for a consult?
Absolutely. I'm on a team. Nicole is our diabetes educator, and her direct line is 330-489-1484. And then our fax number, in order for us to see someone and work with someone, we do need an order from your physician. And that can be faxed right to us at 330-430-2407.
We're out of time. Excellent. Wonderful show. Thanks very much for coming by. Okay.
Thanks for having me.
Thank you, Art. Our special guest, Kate Anderson, registered and licensed dietitian from Mercy Medical Center Outpatient Department. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here again next Friday on Newstalk 1480 WHBC. Thanks, Kate.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.